Good afternoon, and welcome to the Michigan Peer Review Organization's Disparities Cardiac Health Program webinar. Your moderator or host, Melissa Ottinger, will now begin.
Good afternoon. I wanted to thank everyone for joining us today. Before we begin, I have just a few announcements. First, the best practice change management packages that were vetted by Dr. John Slack will be distributed to practices in April. You will be receiving overview and guidelines of our Governor's Award of Excellence sometime this week. Our next data submission will be due April 15th. We will be emailing a new template as there have been some changes. If you have any questions or require technical assistance, please contact dash@mpro.org. Also, we are still looking for volunteers for our community events, and if you'd like to be placed on our volunteer list, please contact a member of the DACH team. Some upcoming events. April is Minority Health Month. If you'd like more information on this, please visit minorityhealth.hhs.gov. The April newsletter will be coming out shortly. Please watch your inbox for that. Let's all get out and enjoy some fresh air. On April 3rd, the American Heart Association's National Walking Day. And our next webinar will be on April 17th. We will have Dr. Janet Wright from the Million Hearts Initiative joining us for our monthly webinar. Next, I'd like to introduce Lillian Preston. She'll be doing our webinar today. Ms. Preston earned her master's degree in business administration from U of M. She is the president of OurHealth Media Network. OurHealth was founded in 2004 based upon the need for health information that adequately addressed the broad health disparities that exist in our society. We'd like to thank her for joining us. Also, just so you're aware, there will be questions at the end of our presentation. And at that time, the operator will give instructions. Lillian?
Thank you, Melissa, and thank you, INFO, for inviting me to do this webinar this afternoon and for sharing information on OurHealth Urban. Thank you. Okay, OurHealth Urban is a new and exciting urban health and wellness television show that brings basic information to urban communities, basic health information to urban communities. Once again, I'm your presenter, Lillian Preston, president of OurHealth Media Network and founder and producer of OurHealth Urban. Just a quick review or rundown of the agenda. I'd like to first give you an overview of OurHealth Urban, and then we're going to talk about the segments that are in the show. We have segments on chronic disease education, personal stories. We look at a community-based program, nutrition and healthy eating. I'll share with you about some health trivia and urban fitness tips, and we have a segment with physician, Dr. John Slack, who our host, who is Dr. Herb Smithman, will interview. And then I'll end with some applications, video applications where OurHealth can also be used in addition to on broadcast television. So OurHealth Urban, a television show that targets urban populations. It serves as a health intervention where we educate about chronic diseases and conditions. We raise awareness in regards to risk factors that cause those or go into those chronic diseases, and we provide practical advice and resources in the management and prevention of chronic disease. It also, this program addresses health disparities, many of the social determinants of health that also play into an individual's health and their health outcomes. Our segment on chronic disease education today, we're going to play for you a segment on hypertension, but the program that you're going to see was produced as a series, a pilot series, In that pilot series, we had 3 shows, one on diabetes, one on hypertension, and another on obesity. And these were designed, once again, to educate, raise awareness, and to provide practical information in terms of prevention and management of chronic disease. So next you're going to see an intro to the show, and the host of the show, Dr. Herb Smitherman, will then educate about hypertension.
Hello, and welcome to OurHealth Urban, the health show with an urban perspective. I'm your host, Dr. Herb Smitherman. On today's show, we're going to talk about high blood pressure, also known as hypertension. Hypertension, or high blood pressure, affects 1/3 of all American adults and is a major risk factor for many other diseases. It's known as the silent killer because often there are no symptoms or warning signs that you even have the disease. So you may not feel sick until a serious problem occurs, like a heart attack or a stroke. But what exactly is high blood pressure? And when you hear numbers like 140/90, what do these numbers really mean? Let's talk about it. Blood pressure is a measurement of the force of your blood against your artery wall or your blood vessel as blood passes through them. High blood pressure or hypertension means that the walls of your arteries are receiving too much pressure against them over and over again. This constant elevation of the pressure in a person's arteries is what we call high blood pressure or hypertension. Causes of high blood pressure or hypertension may include narrowing of the artery, a greater than normal volume of blood, or the heart beating faster or more forcefully than it should. Any of these conditions will cause increased pressure against the artery walls or blood vessels. Over time, this added pressure will cause damage to the blood vessels that carry blood throughout the body, because they were not designed for the constant pounding pressure. This damage can lead to many health problems in the body, including atherosclerosis or hardening and blockage of arteries, causing decreasing blood flow to the heart and the rest of the body. So a combination of the damaged blood vessels, the increased blood pressure, and the decreased blood flow forces the heart to pump harder. As a result, the heart can become overworked, begin to fail and enlarge, which can result in angina or chest pain, a heart attack, or heart failure. High blood pressure can also cause eye damage or blindness because the small vessels in the eyes can rupture or burst from the increased pressure. High blood pressure is also the leading cause of chronic kidney disease and stroke. So now that you know what high blood pressure is and the damage it can cause, the first step in preventing it or avoiding more severe health problems, if you have it, is to get your blood pressure checked on a regular basis and get it under control if it's high. To determine what your blood pressure is, your doctor will use a blood pressure monitor to check it. The blood pressure monitor will show 2 numbers, which make up your overall blood pressure reading. The first or top number is called your systolic blood pressure. This number is the pressure inside the artery or blood vessel when the heart contracts or squeezes, pushing blood through the artery. The bottom or second number is called your diastolic pressure. This number is lower than the top number and represents the pressure inside the arteries when the heart is resting or between beats. While these 2 numbers make up your overall blood pressure, if either or both these numbers are high, you have high blood pressure. To know whether you have high blood pressure, you need to have it checked by your doctor. Once you have your blood pressure reading, this is what you need to know. The best blood pressure to have is around 120/80. However, a goal for most people is less than 140/90. For those that have kidney disease and diabetes, their blood pressure goal should be less than 130/80. In many cases, you may not have symptoms with dangerous levels of high blood pressure. You may not feel bad or sick until it's too late. Some people with high blood pressure do experience symptoms, such as headaches, feeling tired, or feel their heart pounding. The only way to know if you have high blood pressure is to get your blood pressure checked. There are some factors that put people at higher risk for high blood pressure. They are age, a family history of high blood pressure, race, such as African Americans, Native Americans, who are higher risk than other groups, and lifestyle choices, including not being active, eating too much salt, and eating too much saturated fat, being overweight, and stress. Whether it's with the help of medicine or through a healthy, low-salt diet and exercise, or a combination of all three, identifying, treating, and preventing high blood pressure is critical to your overall well-being.
Our next segment that we have included in the show is personal stories. Many times people do better at managing their health when they can relate to someone like themselves. And in our My Story segment, we find everyday people who, after some challenges, have become successful at managing their condition. And what you're going to see next is Deborah Ivory. She was diagnosed with hypertension after she was doing a training for the National Kidney Foundation. And she was doing this training to help identify people who had high blood pressure, and then found out herself that she had it. So here is Deborah Ivory's story.
My name is Deborah Ivory, and this is my story. I've been working, doing hair for a number of years, and then, just taking care of business. I never even really noticed anything about hypertension until I went to a training with the Kidney Foundation. In the training, they had taken our blood pressure. Well, when they took my blood pressure was 220/180. They said, this is extremely high and you need to go to the hospital right away. And so I said, but I feel fine, and so I finished the training, they let me do that, and then I went to the hospital after that. But the training and the program, I didn't feel any different, but I did feel different after I took the blood pressure medicine. Once that came down, I guess I was so used to feeling a certain way, I didn't know that wasn't the right way to feel. I felt on edge and, a little stressed and stuff, snapping at my family, and that was probably due to the blood pressure, and I didn't even know that. I wanted my blood pressure to just get back to normal just through medication. So I didn't really change my diet, and I didn't really exercise. I just thought about it. And thinking about exercising and thinking about eating right didn't help me. So my dosage went up. I needed more blood pressure medicine, so I decided that I would lose weight, eat better, eat healthier, and then I began to walk. I was walking, and my weight went down, and I lost about 20 pounds, which really made a difference. And I took my medication, so my dosage went down. What I wanted to share is, to become aware of what's going on inside your body. It just happens little by little. We don't all of a sudden just pop up and have high blood pressure. It comes from a lifestyle. So however we're living our life, it's not showing up right away, but if we keep going, down the road, we'll see what we've done. We'll see, like, it sounds like I may have some information to share, but I just didn't have this information just by standing up doing here. I had to do some self-development. I had to do some self-improvement for my mind, for my body, and for my soul, because all of these things work together. And without one, the other one is not any good. So everything works together for our good if we love God and if we're called according to His purpose.
Okay, we also feature programs or segments rather within the program that are currently making an impact in the community. These programs address specific needs of that particular community. They're accessible and they're affordable. Some of the programs, Project Impact is being put in the Osborne Connor Creek community, and they address the 48205 and the 4823 area codes in Detroit. And this is with the Voices of Detroit initiative. The National Kidney Foundation has a program called Enhanced Fitness, and the American Heart Association has a program, Teach and Garden. The program that you're going to see next, or rather the segment you're going to see next, is the Enhanced Fitness, which is geared towards making people, adults rather, of all ages, healthier. And here's the segment with Enhanced Fitness.
87-year-old Lovey Whitfield knows the importance of regular physical activity. It helps you in a lot of ways. Keep you alert and you sleep better. Ms. Whitfield participates in the National Kidney Foundation's Enhanced Fitness class at the DACH Recreation Center in Preston. The classes have helped her strengthen her muscles and increase her endurance. When you get older, you lose muscle. And those classes help me to kind of slow it down and keep me moving. According to Enhanced Fitness Program Specialist Chrissy King, that's exactly what the program is designed to do.
Enhanced Fitness is an evidence-based program. It's based out of Seattle, Washington, and the core components are cardiovascular conditioning, which is aerobic conditioning. It also looks at flexibility, balance, and strength training.
The classes are geared toward men and women of all ages and fitness levels. 80-year-old Charles Searcy and his wife Jean have participated in enhanced fitness classes for the past 3 years and say the classes have helped them lose weight.
I lost a lot of weight. I weighed 244 pounds 3 years ago when I came here. Now I'm down to 219.
I decided, well, if I'm going to do the exercise class, I better eat right. So I've lost 50 pounds and 4 dress sizes. The secret is getting up and getting started. This getting started is the thing. Because usually when seniors get old, they think they sit there and just wait.
Wait on the Lord.
Wait on the Lord to take them. But not me. He's going to have to catch me.
Classes are also a lot of fun. Rita Perkins teaches classes at the Roberto Clemente Recreation Center in Southwest Detroit. She says the participants are what make the classes enjoyable.
We have a lot of different exercise backgrounds that come in and work out, and they get together, we get together, and not only, is it a workout, but we socialize and, just have a good time.
I have friends that come here, my comadres, real good friends, and so it's a nice place. It's like a social time to get together, and it's a wonderful opportunity for anyone who wants to get a little bit healthier. I really enjoy it, Can't really get out in the neighborhoods and walk anymore. And most of the gym, I don't really stick to it if I go to the gym, but coming up here, I stick to it coming twice a week.
Enhanced fitness classes give people in the community an opportunity to exercise in a safe environment, socialize with their friends, and most importantly, get and stay healthy. There are several enhanced fitness classes being offered in Michigan, and most of them are free. For more information, contact the National Kidney Foundation of Michigan at 1-800-482-1455 or visit their website. And remember, always check with your doctor before starting any exercise program.
Okay, diet and nutrition are also important to our health. So we included a nutrition and healthy eating segment where we had Dr. Woolbright from Whole Foods. She's a nutrition and healthy eating educator, and she gives information on nutrition, how to shop, what foods in terms of if you're looking for putting more greens in your diet. And then we have a cooking segment that follows the nutritional information segment. So let me show that to you. It's pretty better self-explanatory seeing it. So this is the healthy eating section. What you're going to see them making is a carrot and broccoli stir fry.
We're here now with Mood, one of our gym specialists, who's going to talk to us about putting the 4 pillars into action. What are those pillars? Whole foods, plant strong, healthy fat, and nutrient dense. Mood, what are you cooking for us today?
We're going to make a carrot and broccoli stir fry here. The first thing I'm going to do is add a little bit of oil to the bottom of the pan, just enough to coat the bottom and not so everything doesn't stick. I'm going to add a little bit of fresh garlic that I chopped up to it. I'm going to add some fresh ginger. This ginger, all I did was take a potato peeler and slice it up really thin.
Oh, that smells great already.
And we want to flavor that oil. We want to get as much flavor out of here. We're not adding a lot of salt or anything to this dish. Now we're just adding a little bit of red peppers. They're called Fresno peppers. I sliced them really thin. I took out the seeds and the ribs, so they're not going to be very hot.
I love that you're actually building a base of flavors from low fat and no sodium.
Exactly.
That's excellent.
It's going to make the rest of our food just pop. So now this is going to cook for a couple minutes, and we're going to add our broccoli right to the pan. And we're going to add our carrots. So now this is going to cook for a couple more minutes. We're just going to let everything go. All these flavors are going to merge together and all blend.
That smells wonderful.
And so this, after a couple more minutes, this is going to cook. What we're going to do is a little bit of reduced sodium soy sauce right to the pan.
About how long do you let it cook before you add some soy sauce?
Maybe about 3 or 4 minutes so the vegetables have time to get a little bit tender.
Okay.
And then we're going to take, this is an orange that we're going to put the juice right in here.
I love the combination of flavors you're bringing together.
So soy sauce, orange juice, and, the ginger and the garlic, that's going to season and flavor our dish.
Really helpful.
And then, basically we're going to toss everything together here. And we have some quinoa that are already cooked. Basically, so quinoa just like brown rice or any other whole grain.
Okay.
And so it's already cooked and ready to go. And we're going to use that as a base of our dish. Put the stir fry right on top. Sprinkle some freshly toasted almonds all over the top for our healthy fat.
Beautiful, very healthy fat. That's one of our tools. Remember, guys, healthy fat.
And we cut the heat, and then we're done. And our finished product is right over here.
So this looks fantastic, and I really love the way that you put the 4 pillars into action. And I invite you at home to really work with a wide array of colors every time you prepare your meals. Really bring in that rainbow for optimal health.
Okay, with our program, we also thought it's important to be engaging as well as informational. And we address the social determinants of health in our content, but also in a trivia question. We have for each show a question that we ask the audience, and it's based on some particular social determinant of health. And in this one, for instance, we say, where we live, learn, work, and play can have a greater impact on how long and how well we live than medical care. And then we wait a few seconds, and then we say, is that A, true, or B, false? And then we provide the answer and say A, true, and then we give an explanation as for why it's true. So we try to be a little bit creative in terms of getting the audience engaged, and then give them information as to why this particular issue here, why it's true. Then we have also urban fit tips, and we give our audience information on fitness tips that are related more to urban communities, about perhaps neighborhoods that may not be safe to walk in. The woman from the Enhanced Fitness video that you just saw said, well, my neighborhood isn't as safe, so now I come out and do this program. So we give perhaps safety tips, different things that pertain to urban environments that also help people to remain physically active. Okay. And then we have an interview segment where in that segment we interview an expert. It could be a physician, a specialist, different industry experts and healthcare administrators. And our host will interview this person for about 5 minutes. It's about a 5-minute segment. In this particular program on hypertension, we interviewed Dr. John Flack, and I'm going to show you his segment next.
High blood pressure, hypertension, very significant problem. It affects over 70 million Americans, disproportionately older people, African Americans, over 9 million African Americans have it. It's important because it shortens lifespan. It's uncontrolled. It also causes a variety of preventable conditions such as heart failure, stroke, kidney failure, peripheral vascular disease, heart attack, and even problems in the eyes, what we call retinopathy, and in people with diabetes, bleeding in the eyes that causes need for laser surgery.
Right. So obviously significant potential complications if not treated. Can you tell us what your research has shown regarding hypertension and your recommendations to address this illness?
Well, research that's important for the patient population is that a lot of the hypertension in the U.S., though we know about it, still remains undetected. And even once it's detected and treated, that it's treated very insufficiently in the sense that there's not enough medication, only one or two drugs. So in the national data, roughly 70% of the uncontrolled hypertensives are only treated with one or two medications, which is really problematic. There's just not very many patients who are going to control consistently over the long term with only a single drug. We also know that the earlier you treat, the more likely you are to prevent the bad complications such as stroke, heart failure. So getting it treated young and keeping it down is a good thing. But even if you don't start treating from middle age or older, you still benefit. The issue you asked me about earlier, I forgot, was what's the role of race. And if you go to the United States, African Americans have the highest rates of hypertension of anyone. If you actually look on the context of the entire world, the highest rates of hypertension are not in black countries or in the U.S. blacks. It's in people in Spain, Finland, and Germany. In the United States, the reasons for hypertension being so high in many African Americans probably has to do with a combination of lifestyle factors, diets that are very high in sodium, low in potassium, inadequate physical activity, picking up on weight as we age, particularly in women disproportionately. And I would venture to say they'll improve in probably high degree of psychological stress.
So lifestyle is critically important.
Lifestyle's critical.
Critically important. But also it sounds like you're saying access to basic health care is also important because it requires some medication most often. So, oftentimes you hear people say, do I have to take my hypertensive medication every day? Is it okay to skip, one of the pills here and there, even if I'm feeling okay?
Well, ideally what you should do is take your medicine whether you feel good, you feel bad, whether your pressure's high or whether it's controlled. In fact, I'll have patients who say, well, I stopped taking my medicine because my blood pressure was controlled. And when I try to convince them that the reason your pressure was controlled, it's in all likely because you're taking the medicine. Lifestyle is very important, and if you can cut your salt intake, increase your potassium intake, appropriately exercise, cut your stress level, don't drink too much alcohol. In many people, you can clearly lose weight, drop your blood pressure, and also weight loss if you can accomplish it. And many, though not all patients, but many will help lower their blood pressure. If that was all we needed, we wouldn't need the medications. And so the typical approach is you get all you can with the lifestyle. You try to get people to follow the best diet they can. You take what you get, then you treat them. And the amount of drugs needed to treat them to control their pressure will be less if you can get them to do more with their lifestyle.
So, excellent. And one of the issues is there are a lot of people out there that are simply saying, I feel great. I'm doing well, everything's okay. But, oftentimes hypertension doesn't have symptoms, and so it's been labeled the silent killer. Can you really talk about that a little bit?
In many people, high blood pressure doesn't cause symptoms, but in a fair number of people it does. And people where it does cause symptoms, the symptoms outside of headache are not really just typically linked to hypertension. Things like sleep disturbance, waking up early at night, nervousness, chest pain, fatigue, those kinds of things, poor exercise tolerance. We ask our patients about this all the time, and many of them have these symptoms, and it is linked to the level of blood pressure. But interestingly, the blood pressure doesn't have to be very high at all to pick up these symptoms. And also, when you treat the blood pressure and it comes down, the patients typically feel better. One caveat, in the short term, when you drop blood pressure, sometimes people feel bad, particularly if it falls fairly significantly early on. But they just kind of fight through it. That gets better because most people ultimately feel better at lower levels of blood pressure.
Okay, so obviously lifestyle, taking your medication, it is a silent killer, so sometimes there are people out there who actually have serious high blood pressure, but actually may not have symptoms. Any takeaway message for our audience, Dr. Flack?
Yeah, a couple. One, you need to know your numbers, get your blood pressure checked, and get it checked on a regular basis. Two, make sure that you do what you can to stay active, get moving. Three, definitely work on your diet, particularly with high salt foods, because most of the salt in our diet is in the food before we see it. Sodium is the number one thing that makes it harder to control blood pressure, will raise your blood pressure. And if you can cut your dietary salt intake by cutting down foods like breads, chips, pickles, soups, processed meats, fast foods, your blood pressure will fall and fall pretty quickly in the short term, and the drugs work better.
Wonderful. Thank you, Dr. Fleck.
Okay, OurHealth Urban was designed for broadcast television, but there's many other applications. It can be shown in doctors' offices. It can be in hospitals and clinics. You can also have it shown on mobile devices, smartphones, tablets, the internet. It can be housed on websites and used through social media. You have YouTube, Facebook, and other social networking sites. And then also it can be placed on DVD, where it can be given out to patients. Churches can give it out to their congregation. It can be used in a number of applications. So that is OurHealth Urban. We are excited about this program. It aired first in November of last year, and was rebroadcast again February of this year. And we're looking to do more shows. We're looking to partner with more organizations and learn about more programs that are out there, so we can get information out, basic health information out to our urban communities, where many of our most vulnerable, underserved, and minority populations are, and where there are large health disparities. So we hope that in some way this can help to reduce those disparities. And that ends my formal portion of the presentation, and I'm going to turn it back over to Impro. Melissa.
Operator, if you can please give instructions for questions.
Ladies and gentlemen, if you would like to ask a question, please press the number 1 key. Again, ladies and gentlemen, if there are questions at this time, please press the number 1 key. Moderators, we have no questions in queue.
Okay, we do have a survey for the participants on the call. So if you can please answer the questions before you disconnect. And we wanted to thank everybody for joining us today. As I said earlier, our next webinar will be on April 17th with Dr. Janet Wright from the Million Hearts Initiative. We want to thank Lillian and Preston for joining us today. And once you complete the survey, you guys can all have a nice day.
Ladies and gentlemen, this does conclude your conference. You may all disconnect, but please do fill out the polling questionnaire evaluation. Thanks and have a great day.